Tonight, there are concerns Victoria's coronavirus outbreak is not under control, with another 459 new cases recorded, another 10 lives lost. That's the second highest number during this wave, just behind Wednesday's record 502 cases. In total, in Victoria, 228 people are in hospital, 42 in intensive care, and so far, 71 have passed away. Premier Daniel Andrews says there is some comfort in that the numbers are stable, they're not doubling. But he now warns the lockdown might last longer than 6 weeks.
The fact of the matter is, John, I can't tell you where we're going to be in another 3.5 weeks. But what I can confirm for you, for your readers, for every single Victorian, is that the data will drive the decisions. The advice from the Chief Medical Officer, Chief Health Officer, and indeed the Chief Medical Officer at a federal level, so public health experts, will provide us with advice on what next steps should be, and we'll follow that advice because we've got to be led by the data, the science. I can't predict where we'll be tomorrow, let alone with any certainty give you a sense of where we'll be in another 3.5 weeks.
Now, you'll probably remember I first brought you evidence a couple of weeks ago that Victoria was turning people away and refusing to test them if they had no symptoms, even if they'd been in close contact with a confirmed COVID-19 case. My story related to McDonald's workers who'd been in contact with an infected employee in Melbourne but were refused testing. Well, despite this revelation 2 weeks ago now on Sky News and on the front page of The Australian, Victoria has not fixed the situation. Dana McCauley in the Sydney Morning Herald writes this weekend that the Department of Health and Human Services has ordered doctors at testing sites not to test anyone without symptoms unless they present with a formal letter or text message identifying them as a close contact, or a letter proving that they're booked in for elective surgery. Now, we know, and we've been told for months and months now, that people can spread the virus and can contract the virus even if they have no symptoms, if they're asymptomatic. Until the Victorian Government starts a proper testing regime and starts testing people who've come into contact with a confirmed case and then does the appropriate contact tracing, they're not going to get on top of this outbreak.